I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go. Welcome. And thank you to all of the new subscribers that have joined within the past few weeks or months. Thank you so much. Today, we are covering a very complicated case. This case is also out of Utah, and it is two friends. And the defendant in this case, her name is Meggan Sundwall, and the victim, her name is Casey. And Casey, it seems like Casey had significant mental health concerns. And the reason why I say that is because Casey had a long history of just grief and loss within her family, a lot of legit medical concerns within her family. And this case, like, I have never seen a case with more twists and turns. And I did a prior video that's linked down in the description talking about fictitious disorder. Sorry, factitious disorder. I keep saying fictitious. Factitious disorder is the way that you pronounce it. And that's what we used to call Munchausen's. And Casey seemed to know that she didn't have cancer because she didn't tell her doctors that she had cancer. She only told her friends and family, people that weren't able to confirm it. Those are the people that she told that she had cancer. Because Casey only had one kidney, she had a port that would allow her to get fluids easier. With only having one kidney, she was at a higher risk to have certain complications. I do think with her using, because I believe she was misusing prescription medications, and some of those medications can damage the body. And so, no telling what that damage did. But her friend Meggan, so we say friend, her friend Meggan, they had been former roommates. Their relationship seemed very codependent because Casey is complaining about how much pain she's in and how tough it is for her dealing with this terminal cancer diagnosis. And her friend is like, I'm paraphrasing, this isn't exactly what she said, but her friend is almost like, going ahead and die. Like, don't fight it, don't hold on, just going ahead and die. And at some point, there's talk of specific ways that Casey could not be here anymore. And Casey seems to have mm, lied and made Meggan think that she was on board with this plan. I question if she was truly on board with that. I think she wanted Meggan's attention, and Meggan had some financial difficulties. And Casey lied to Meggan and told her that she was going to, like, she was going to get over $1 million when Casey died. Because I covered it during my last video, because Casey's father had Meggan's father had cancer, and Meggan told him to get treatment. But her friend supposedly has this cancer diagnosis that she's had it for like 10 years. So it wasn't like it's been a year or so. She said that she's been on hospice since at least maybe April. Meggan thinks that she's communicating with Casey's hospice doctor. We find out today that she was actually, the number for the hospice doctor was actually Casey's father's phone number. So Meggan thinks that she's communicating with Casey's hospice doctor, but it's actually Casey's deceased father's phone number. And Casey's father died in 2011. All right. So this whole thing is just very, very strange, very, very odd. And thank you for mentioning, someone in the chat mentioned having kidney disease and had a port. Now there's just a scar where the port was. Your port was for dialysis. I have a family member that needs that gets dialysis, and so they do have a port. They're on a wait list for a kidney transplant. And this whole thing is just wow, because while Casey is receiving saline, she's telling other people that she's receiving chemo. Excuse me while I parent. Hey, buddy. So you want to watch YouTube? What's up? I'm 66.9. 66.9. Oh, cool. You weighed yourself. Cool. Nice. Awesome. All right. Yeah. I think it was like 60, 63 or 60. It was in the 60s the last time. Yep. Yep. So we monitor our kiddo to make sure that he's on the right growth chart, the right growth path. He's a very, very picky eater. And when he was like 4, I think it was between 4 and 5 years old, he didn't gain enough weight. And I had to like get extra calories in him with like butter, and we were doing Ensure, or we were doing kids versions of things. And so that's a side note. Kiddo is fine. And so they haven't really clarified who was answering the phone. So we don't know. But I do have the text message that Meggan sent as Casey is likely dying. Meggan reached out to Casey's hospice doctor, but she's asking about scheduling a surgery. And so that was a little confusing for me. That was a little confusing. Really, really confusing. So, let's get to some of my notes on this case. So I'm covering day 4. Today, they started out with a officer, and this case was one of this officer's, I think, first cases. Poor baby, because the defense went at him really hard because this officer coded the incident as a medical response and not a crime. His body cam footage wasn't saved, but there were multiple other people that were there and their body cam was saved. And so it wasn't like there was anything nefarious or like, but I think this officer, because the original call was medical, and at some point they begin to suspect that some type of crime has happened. Um, and let me see. Um, so the officer described when he arrived, he described Casey's breathing as a violent breathing, and that there was a syringe on the floor, and a fireman picked up the syringe and placed it on the nightstand, and they were able to show a picture of it there. They were looking around for medication bottles, and they saw all types of medication bottles, including empty narcotics bottles. They tried to look for a do not resuscitate, because when they arrived, they were told that Casey had a DNR. But later, another officer is going to clarify that just because somebody has a DNR, that does not mean that they don't want care. So even with a do not resuscitate, a person can still receive comfort care that helps their pain. Because let's say somebody is terminal and they're on hospice, they still can receive certain interventions. And we're going to go through, because they later on, it comes in a little bit later, but I do have a picture of the insulin readings. That testimony came out today. So I'm going to stay on track and stick with this first officer talking. As they're looking around, they did find an envelope with Meggan's name on it, and it was sealed. And he did not open that envelope. That envelope is going to become important a little bit later. And he did mention the fact that Meggan left the home when they arrived to the house. He indicated that it was a medical call. And once again, that was the body cam issue. The defense also pointed out the fact that Meggan was told by the family to leave, because I think once Kylie realized, so Kylie is Casey's sister, and Casey had told Kylie that Meggan was trying to kill her. And so that's what makes all of this so much more confusing, because Casey's telling Meggan that her family, according to Meggan, is telling Meggan that her family is harmful to her, and Megan's family is, the best family she has. I'm paraphrasing. But then Casey is telling her sister that, like, to come and get her so that she can move out in the middle of the night because she thinks that she thinks that Megan is trying to kill her with insulin. So Casey's sister Kylie testified to that way before this incident, Casey had said that Megan was trying to do something with insulin. It's a whole thing. So then we get to the phone extraction. And there between 2019, and it might be like December 2019 and August of 2024, there were over 28,000 messages between Megan and Casey's phones. And when they compared the two phones, they realized that Megan's phone had messages deleted. There were about 618 messages that had been deleted, and there were about 200 messages like the 3 weeks before Casey died. Megan had deleted certain messages, and the messages that were deleted were talking about self-deleting, life insurance, and insulin, or like Megan assisting in the process. She also removed a heart from a message. And I guess there was some message where um, Casey was talking about, let me see if I saved it. I don't think I saved the specific message. I don't think I did. But there was one specific message that initially Megan hearted, and then she removed the heart from it. And this was a message from, like, I think it was like April of of 2024. And this incident happened August 12th of 2024. Okay. So they went through the internet search history, and on Casey's phone, I thought it was interesting that Casey had a search of, is it okay to give yourself a shot with just saline in it? Because it's my personal belief that Casey did not want to die. I think she wanted attention. I think she wanted to be in that sick role. I think Casey wanted to avoid responsibility because it came out that she had stolen over like $60,000 from her grandparents' account. And that resulted in, after her death, that resulted in a fraud investigation and a referral to Adult Protective Services. Um, and so, with all of that, with Casey searching, is it okay to give yourself a shot with just saline in it? Because Casey is telling Megan that she's on board with the insulin thing, but I don't think she was. I personally don't think she was. I think there was a part of her that wanted to live, but I think she wanted Megan's attention. And on Megan's phone on August 11th, so the incident is on August 12th. On August 11th, Megan is searching for vacation tickets, cheap flights with Allegiant. I have never flown Allegiant. I've never flown Spirit. My preferred carriers are JetBlue, American, and Delta. Really, and United. Yes, because JetBlue or United, I have perks with them, but I also sometimes have to fly because I do direct. I do not like a layover, and so I love a good direct flight. All right. Um, so she was also searching for jewelry from Brian Anthony's. I know nothing about that jewelry. I think it's a jewelry store. I don't know. And she was also searching Antigua Bay, Anna Maria, Florida. So she's searching these things. So at 1 p.m. on August 12th, she's searching for Domino's. And so that's where I was wondering, did Megan order food while her friend was in a diabetic coma? Is she over here eating? Like, it was So I think Southwest has unassigned. So Paul, I need an assigned seat. So I believe Southwest changed their policy to now you can have assigned seats now. I do not. I can't do like I pick my seat in advance. If I fly by myself and if it costs more to pick my seat, then I sometimes won't worry about it. But if I'm with my kid, if I'm with my husband, or if I'm flying with somebody else, I definitely pick my own seat. All right. Side note, side. Sometimes we have side quests. So let's see. Um, there was also Meggan searched freestyle light, how low can it go? And we find out that the freestyle light is the test strips for diabetes. That's how the glucose is continuing to be checked and monitored. And the readings are getting so low that medically, in my personal opinion, there's no way that Casey is doing these herself at a certain point. And Meggan texts her mom that around almost 2 o'clock, 2 p.m. on August 12th, saying that she can't wake Casey up. So any readings after 2 o'clock, in my just personal thought, it was definitely Meggan doing it. And Meggan is a nurse. So because she's a nurse, I would think she would know like what to do in this situation. And I think she might, in her mind, might try to justify. So she's saying she's not guilty. Okay. So Meggan is saying she had nothing to do with it. Casey did this to herself. Like that's what the defense is trying to say. That Meggan was trying to honor her friend's wishes. The defense Casey was exhausting and Meggan thought she was helping. I don't know what they're going to try to say because this clearly seems like a crime to me. You can't just sit there and watch somebody die. You just can't do that and you think you're going to get $1 million when this happens. Like this case has more twists and turns. It is a lot. All right. And so there we mentioned, and then so they also have that Casey tells Meggan that she was her person and she would be notified if something happened to her. That was the message in April of 2024 that Meggan removed the heart from. And she removed this heart on August 17th, 2024. Casey died August 12th. So after Casey's death, she died technically August 15th. So the incident, all this happened at the house because they were able to keep her on life support. But at some point there was no brain activity. They did not feel she was ever going to wake up. And the life support was removed and they just provided comfort care. And Casey did pass on August 15th. Okay. All right. But this whole incident starts on August 12th. All right. The defense brought up the fact that the person looking at the Cellbrite data, because he's cross-examining the data guy, and that he works for the prosecutor's office. He's doing what the prosecutor's asking him to do. And me, as like a trial watcher, I know that the defense can hire their own cell phone data expert. They can have their own extraction of the phones and they can present any evidence they want to present from these phones as well. But I think the defense was trying to attack his methods or his credibility. I don't know what they were trying to do. But the things he had said was kind of bad for their client. And so the defense is going to do what the defense is going to do. But so we listened to that part. Let's see. They also mention that Casey's phone is up and moving at 7 a.m. that day, and that they all acknowledge that anything that happens to Casey's phone after 1 p.m., we don't know. Like it could be somebody else moving her phone. It could be somebody else unlocking her phone. They do not know what happened. And the defense is going to email him a question because the defense had a very specific question about the number of feet something moved and the guy wasn't able to answer it based on the graph, based on what the defense showed him. And so the technology guy might be back. Okay? So it is what it is. So, another officer testified about the fact that Casey was not diabetic and that when Mark came downstairs and found that Casey wasn't doing well, and he said he was going to call an ambulance, Meggan said there was a DNR and that Casey didn't want to go to the hospital. Now, this is all according to Meggan. Uh, Meggan said that she had talked to Kylie and there was a DNR. And this is where the second officer that testified today said you can still go to the hospital even if there is a DNR. Because DNR is basically don't put me on a breathing machine, don't intubate me, those kinds of things. Um there they talked about how that the family that was in the home, that they were not notified that Casey was doing poorly. And they talked about the fact that Casey's room flooded and that they noticed a glucose monitor on the desk in her room. So now let's get to the glucose monitor, to those readings. All right. So let me share my screen. Okay. So this was an exhibit. I apologize that it's a little light, but this was an exhibit that was shared. And the first reading, so there's a monitor time, but there's a 2-hour difference between the monitor time and the actual time. And so this exhibit was made to just make this all clear. So on 8/2, the first blood glucose level is 87, which is in the normal range, and that was at 9:18. So Meggan arrives to the house at she arrived to the house at like 9:58, 9:55. They have her on camera arriving to the house right before 10 a.m. And so at 10:26 a.m., the reading is 86. I wonder if and then I wonder if something happened. So going down to 77 might not be a huge thing because then 1 hour later, it goes down to 77. 11, right before 12 o'clock, it's 80. Right before 12 o'clock again, it's 79. It goes down to 76 about 12:30. Almost 1 o'clock, it's going down to 69. So I wonder if if she's been injected with insulin at some point, or if insulin was placed in one of her Fanta cans. So the state seemed to not know exactly how the insulin was administered. And they seemed to mention the fact that the Coca-Colas that Meggan liked to drink were in the refrigerator. And in the refrigerator, there was also the family's insulin was in the refrigerator as well. And so the state, so they didn't say that directly, but in my brain, I'm trying to put two and two together. And so I'm like, ooh, I wonder if they're trying to say, like, because they're talking about all the Fanta cans, because there's Fanta Zero that's in the room, and that was Casey's preferred drink. But when they asked Meggan about Casey's preferred drink and if she drank Fanta, Casey said, I don't know. No, it is what it is. I don't know. So then about 1 o'clock, it's 64. Something happens between 1:13 and 1:43 because she's now down to a 43. And a blood sugar level under 45, you are likely going to be a little confused. You might be sleepy. But from here, it goes down to 30. It goes down to 29. And so we're still around 2 o'clock. It goes down to 27. And so at this point, in my just personal thoughts, I don't think that Casey is able to take any of these readings after 119. So if Casey was doing her own readings, she might have been able to do it. But once it gets down to 43, I don't think she's doing these readings. And so at 2:22, it's 27. At 2:44, it's 28. at 3 o'clock, it goes up to 32. It goes back up to 33 at 3:16, and then it starts to go back down again. And by 4 o'clock, no, wait a minute. I'm doing it in my head. Yes, because this is 12, 1, 2, 3. Yes. By 4:17, it's so low. So LO means a low reading. And that is so low that the monitor can't even pick up how low it is. The first reading that they were able to get when Casey was taken to the hospital was a 14. That was the first reading they were able to even get to register on, and that is date like that is there's damage, there's all types of problems with a blood sugar that low. And so you were told there would be no math. Me too. So I'm glad I lived in Germany and we had to do military time. So I have had to do military time. I don't like it's just 2 hours. Like it's technically 12 hours, but you just drop the one and you subtract two. But that was math. that was math. So I think the state is doing a good job proving Meggan, who is a nurse, is watching her friend's blood sugar drop dangerously low. And then she continues to take that reading at times it's every 10 minutes, 10 to 15 minutes. She's continuing to take her level, and she's not calling the police because let's say Casey tried to do this to herself and she somehow Meggan realizes what's happening and the reading is 43. Somebody can come back from a 43. But they have to get immediate intervention. There was no immediate intervention, and she may have continued to administer insulin. So in 3 days, they were unable to stabilize Casey's insulin level, her glucose level to a normal level. So even after 3 days. And so that's where there is the suspicion that she was given over somewhere around 100 units, maybe over 100 units of long-acting insulin. So long-acting insulin is for people with type 1 diabetes where their body is unable to produce insulin through the pancreas on its own. And that helps them manage their blood sugar. They will often have to do additional readings. And so I think the uncle who lived in the home, Uncle Matt, Uncle Matt, I think it's Uncle Matt. He mentioned he did readings maybe 4 to 6 times a day, but doing that many readings is not normal. Not normal. And even if Meggan did think she was doing her friend a favor, assisted this is illegal in Utah. It's still a crime. And some people are thinking that Meggan knew that she didn't have cancer. I don't know. I don't know. I don't know. And even if she did think she had cancer and she did think her friend was terminal and she did think that she was helping her, you can't do this. You can't. This was illegal. And they're close to states where death with dignity, but Casey would have never qualified for death with dignity because she didn't have cancer. She didn't. And so then we talked about the readings. Oh, so they mentioned 3 to 4 readings a day would be normal. I know some people that take them after meals, or like I know some people take them a little bit more often. The security camera across the street showed that Meggan arrived at Casey's house at 9:54 a.m. And low reading is a blood sugar of 19 or less and that it was 14 when she arrived at the hospital. And that was the first reading they were able to get. And like I said, in those 3 days, they were unable to stabilize her insulin level. The police officer that was on the stand talked about interviewing Meggan multiple times. The first interview, Meggan said that Casey had been sick for a long time, that Casey had been in hospice since April, and that Meggan had communicated with her doctors and nurses about her care. Meggan said that Casey had a broken femur the month before, but we know that was the knee replacement surgery. So I wonder, so that's where Casey could have lied. And I wonder if there are those messages. So Meggan says that Casey had a broken leg, but we know Casey actually had knee replacement surgery. And if Casey had told Meggan, I'm having knee replacement surgery, and he doesn't be like, who would give somebody with terminal cancer knee replacement surgery? Like you wouldn't do that. And the orthopedic surgeon that did the surgery, he was like, yeah, I would never, if somebody has, terminal cancer, if they're thinking of harming themselves, those are all reasons why somebody could potentially not be able to have surgery. And so yes. All right, so I'm confused. This is a confusing case because Casey told Meggan and her family she was terminal. Yes, that is true. But it was a lie, and I think it was for attention. I don't think Casey wanted to die. I don't think she did. I think she wanted to live. And if she did die, I think she knew Meggan was the one that would do it. And I think that's why she might have told her sister that Meggan was trying to harm her. But she never set any boundaries with her. This whole thing, everybody needed therapy. Everybody needed somebody to tell them that, ooh, that's not healthy. That's not normal. A good friend, if you say that you're dying, they don't say like, oh, like die sooner so I can get the money. That's the gist of it. That wasn't exactly what was said. Meggan was a RN. How didn't she pick up the clues? So that's where I believe there are messages where Meggan is encouraging the use of insulin because of how much insulin is available in the home. It's my understanding that Meggan was possibly the one that was encouraging Casey to use insulin to do this plan. So, ooh. Yes, we definitely call this an unreliable historian. And her primary care doctor called her a frequent flyer to the emergency room, and that there was likely some exaggeration of physical complaints for drug seeking because she was trying to get pain medications. And well, that's what I'm saying. He didn't say that. And then also that she was trying to get attention for those things. Super, super, super sad case. Somatic illnesses are difficult because the person genuinely believes they are ill. But that's where Casey didn't tell her doctors that she had cancer. So that's where so if Casey had told everybody in her life and strongly believed that she had cancer, and so Casey knew that she was giving herself saline and not chemo, but she told her family she was giving herself chemo. And so that's where I don't think Casey thought she really had cancer and she had been saying she had terminal cancer since I think 2015. So for 10 years, she had been saying that she had terminal cancer. So I work with people that experience physical symptoms somatically. So some of her things she might have genuinely believed. So like because they weren't able to confirm, I think, endometriosis, because the doctor went over multiple things and which ones they were able to confirm with lab diagnoses and with different things, and what things they maybe weren't able to confirm, and which diagnoses heavily depended on Casey's self-report. Casey's mother died when she was 3. And so I do think there was some legit mental health things going on. So I am in no way trying to minimize that. And at the same time, I do think it was clear that Casey knew she didn't have cancer. So she did have only one kidney, and she had like severe kidney issues. She had a whole bunch of medical supplies. She was likely tired a lot. The knee replacement surgery, she did have a grade 4 bone on bone. So she did need knee replacement surgery. That was all needed. She was possibly going to have knee replacement surgery on her other knee. But somebody that gets knee replacement surgery, to me, that's a person that wants to live. That's a person that's trying to improve their quality of life. Now, she was also using Xannies and Oxys. So she was also selling, it's alleged that she was selling some of her pills to get a Xanax. And then she was also stealing from her grandparents. She said that she would help manage her grandparents' bills and she would pay bills for them. But it sounds like she dipped in and she was taking money out of their account to the tune of like over $60,000. Okay. Like, yes. So I'm definitely not picking on her. Like, I think Casey needed significant help. I think she had grief and trauma, anxiety, depression. The way that I view attention seeking is it's somebody having a legit need, but they're going about getting that need met the wrong way. So I work with individuals with borderline personality disorder. It's one of my favorite types of cases to work with because all of my clients with BPD often have complex trauma. And when we address the underlying things, that often helps improve their quality of life. All right. She was never diabetic. And she knew. So she didn't think she was diabetic. The insulin being given was to end life. So she was never diabetic, but she did take that glucose reading herself. Her friend Meggan was telling her to use insulin to end her life. And remember that search. Casey searched, can you put saline? Can you inject saline in, like, if you inject saline in you, will anything bad happen? So I think Casey might have filled up some of her medical syringes with saline, making her friend Meggan think it was insulin. And this is just my speculation. I don't know this for sure. The only two people there were Meggan and Casey. Those are the only two people there. All right. All right. So let's keep it going. So Meggan says that her and Casey watched movies until Casey fell asleep. So during Meggan's first interview, she said that Casey was slurring her speech when she arrived. And then at some point, Casey was in the bathroom for a long period of time, and that she came out of the bathroom around 2:30. I don't know that that's true with all the glucose monitors, unless she took the glucose monitor with her. Because Meggan texted her mom that she couldn't wake Casey up before 2 p.m. So I don't know that that's true. Just my general thoughts. So let's look at the message that Casey sent to who she thought, sorry, Meggan. My gal know me in names. Let's look at the message that Meggan sent to who she thought was Casey's doctor. I apologize that this is like very light, so I will read this to you all. It says, "Hello, Dr. Mastelli." Like they say his name. It's Malcolm Mastellier. I don't know if it's French. This is Meg, Casey's friend. I'm just trying to touch base with you and see where we are with getting surgery scheduled. Casey's memory isn't the best, so when I ask her, she isn't always very clear. And this message was sent on 8/12 at like 12:24 p.m. That is just I thought that was odd. Why would she be sending that message? So I don't blame Utah. Okay. So Utah has open courts. I don't blame Florida either. I know Florida has a lot of like weird, I don't know. They have a lot of weird crimes, but they have open courts. I think it's some law they have where courts are allowed, cameras are allowed in court. It's not all Utah. It's not all Utah. All right. So it was 12 p.m., right? That was the time I saw. I saw 12:27 PM. That's what I saw. But it might be UTC. I don't know. Um, I could be wrong. But why are we messaging? Because there's the insulin stuff happening at this point. We're checking blood sugars regularly. I just thought that was odd because Megan tells her parents that she's been communicating with Casey's hospice doctor and that everybody's aware of her current situation. And I don't think that was true. I don't think that was true, but it is what it is. Let's see. They also yeah. Yep, it was 12:47 PM on August 12th. So then at 1:59 PM, Megan texts her mother about dinner and says that Casey isn't doing well. I can't even wake her up. And at this point, her blood glucose level was 30. And once again, she's not calling the for any help or assistance. She's not, and she's a nurse and she knows what the blood glucose level is because she keeps taking it. And then they also mentioned that Casey's biggest fear is that she would drown in her own fluids. I thought that was sad because when they talked about her breathing, it likely got to a point where she was struggling to swallow. And this was likely very painful. This was not comfortable. This was sad. When Mark entered the room and Megan said that there was a DNR, she also told him not to call 911 because of the DNR. And then, of course, they call Kylie, and Kylie's like, she's trying to kill my sister and get her out of there. And Megan leaves. All right. And they do call 911. They come and they take her. So during the investigation, Megan wanted to know if there would be an autopsy. And so this was a second phone call. So this was a recorded phone call. She wanted to know if there would be an autopsy, and she was informed that yes, there was already an autopsy, but they were still waiting on toxicology. Megan also said that Casey had an attorney, Derek Marshall, that should be contacted to discuss further steps. And that there was this blue box that had the documents that Megan needed. Megan was interested in the life insurance letters and the funeral paperwork, and that information was meant for her. And that's when the officer lets her know that there was an envelope found with her name on it, but the envelope was empty. She asked about, um, and so a lot of the interviews, and I don't know if they'll ever make them public where we can see them because the state is having to talk about this information and not just play some of this because they're on a time constraint. So I think they've told the jury that they would be done with service by a certain date. And so the state is trying to move through witnesses. The state today asked the judge if they could make lunch 40 minutes instead of an hour, and if they could make breaks 10 minutes instead of 15. And the judge was like, hey, y'all are doing bad time. And so like, no, like the judge was like, we're getting an hour. I'm an RN, I would have called. Exactly. DNR does not mean do not treat. Exactly. So what does somatic mean? Somatic means when in psychology, when we talk about somatic complaints, a person can have a stress headache that is related to tension and stress, which is like mental health. And it's not related because like migraines can, and sometimes tension. So this might not be the best example, but somatic complaints are physical complaints that are a mental health manifestation. So anxiety, depression. So I know when I get super anxious, I can feel it in my shoulders. Sometimes my stomach gets queasy. I know sometimes I'm really excited about something, like, I can feel it in my body. That is somatic. There are somatic therapies that try to connect people with their body so that they can regulate their emotions and their body better. So, yeah. Yep. I love these questions anytime. All right. And so They played a phone call of Casey talking with there's a John Hancock Life Insurance, and she called, and because I'm sorry, Megan. Megan calls John Hancock Life Insurance because she believes Casey has a policy. And I think Megan thought the family was trying to like keep things from her. Because I think Megan thought she wasn't, because Casey told her that she was going to get money when she died, but that was all a lie. And Megan even thought that this specific friend, Mike Dolan, had paid over $2,000 of the premiums toward the money. I'm sorry, toward the insurance premium, and that was not true. Um, so after Megan finds all this out, she has a third interview with the police. And during that interview, she said that she didn't believe that Casey had an insurance policy. But if she did, she thought the policy was like $1 million. That she never believed that Casey had thoughts of self-deleting, and that and when asked what did she do during the 11 hours she was at the house and Casey was deteriorating, she said she did nothing. She did nothing during that entire time. And that could be a crime. I don't know. Like with some of the messages and things, and that's where I'm interested to see what else comes out. But her sitting there, because also I don't believe that she did nothing, because the blood sugar gets so low. There's no way Casey was doing those blood sugar monitor, like she was doing it herself. So even if Megan says, I didn't know what she was doing, at some point her friend passes out, she can't wake her up, and she continues to take her glucose levels. And it keeps dropping lower and lower, and she never calls anyone. Megan was specifically asked what she would have done if Casey had died. And Megan says that she would have called the mortuary. And as a nurse, she would have signed the death certificate. And the officer clarified that mostly doctors, and there are only certain people that can sign a death certificate, but she wouldn't have been able to sign the death certificate. Um, and so she also said that she deleted all those messages because she didn't want it to look like what Kylie was accusing her of, that she was being accused of murdering Kylie's sister. And so those are my notes for today. This whole thing this case is a lot, a lot, a lot. And the way that I look at somatic complaints is that sometimes people don't have the words for it's easier to say my stomach hurts than to say I'm worried, or like my head hurts than to say like I'm feeling sad. And so sometimes people experience their physical sensations, and some people have legit medical concerns. So there have been situations where somebody was complaining of headaches a lot and they had a brain tumor, where somebody was complaining. I'm not saying, so don't go think every headache is, but I'm just sharing in general. Sometimes you have to make sure that there isn't a physical reason, because sometimes doctors will, for real quick, refer to mental health. So I work with a lot of clients with chronic pain and that have difficult to manage symptoms like fibromyalgia, or they have POTS. They have different different autoimmune, rheumatoid arthritis. They have different issues, concerns. And while stress can increase their symptoms, and being better able to manage their emotions definitely helps their symptoms, their physical symptoms also have to be managed too. And so it's a lot. Yeah, the deleting text, it looks super suspicious. Super duper suspicious. And so, yeah. Conversion disorder is so I think conversion, they often think a person is doing it on purpose. Do, do, do. Yes. So conversion disorder is a condition where patients experience real involuntary symptoms such as paralysis, seizures, without an underlying neurological disease. And so that's within the somatic disorders. Conversion disorder is one of the the different um the different somatic disorders. Okay. That factitious disorder is another one. And I think if Casey had had a psychological evaluation, she likely would have met criteria for factitious disorder, maybe a personality disorder. I don't know. Um, and underlying it all, I think there was some complicated grief. I think there was a lot of grief. And my personal thing is, I think if a friend comes to you and says, "I think I'm dying," you don't say, "Can I help you?" Like, no. Like, if a friend says, like, "I'm really sick. I think this is the end," I would be like, "I'm here for you. What can I do for you?" You know, um, "What are the doctors saying?" I don't let but, like, you don't say, "Can I help you?" Like, "Can I help this happen sooner?" I you don't do that, especially if you think you're going to benefit financially from their death. It makes it look super suspicious. You're probably gonna be charged with a crime. Yeah. Yep, yep, yep. There can be stress-induced asthma attacks. Yes, yes, yes. And sometimes, panic attacks can almost can sometimes, feel like different things too. So, sometimes people will misinterpret a panic attack as a, heart attack, and, um and it's actually a panic attack, which is so somatic doesn't mean fake symptoms. Like, so the physical symptoms are real. The person is having those symptoms. I think Casey had very real pain. I think the way that she tried to navigate life was through the sick role of getting sympathy, having people feel sorry for her, and that she might have needed to be the center of attention. And I mentioned some of those things in my first video covering this case. And so I appreciate you all being here. I did a video covering Corey Richin's verdict earlier today. If you haven't seen that one, make sure to check that one out. My next official video will be Saturday. Do we have plans this weekend? We're doing a garage sale. And then what else? My kiddo is trying to make extra money. And so we have that scheduled for Saturday. I think I'll still be able to stream by 2 p.m. And so yes, yes, yes. I hope you all have a great rest of your day. I will see you all on Saturday around 2 p.m. Eastern. Have a good one. Bye.